Sudden cardiac arrest is a big problem in this country. It strikes over 350,000 people, and the average survival rate remains dismal, only about 5%.
Inside the heart, there is a complex electrical system, and there are pacemaker cells which tell the heart to beat. And when that electrical system isn't functioning well, people either have a very slow heart rate and they need a pacemaker, or if it goes haywire, they'll keel over. It's total chaos, and the muscle just sort of fibrillates, and the pump doesn't work. And that is the leading cause of death in America.
I think that the Survive and Thrive Conference is kind of a perfect opportunity for some of the groups that exist in Minnesota to really join together. You know, we're talking about these different areas of medicine and areas of patient care as well as the survivors, but I think right now there's so many advocacy groups out there for, you know, survivors of children or parents or, you know, adults or young adults. I mean, we just have so many groups out there. And one of the things that I've been looking for is a good opportunity to bring all these threads of advocacy and support together. And this conference is a great venue for that.
This is the only conference that I know of that is specifically geared towards the holistic approach of connecting cardiac arrest survivors and EMS personnel and medical technology. So it's a really unique operation.
The fact that we're integrating arts into the medical humanities is a really exciting idea. And even if you're not an artist, it's still something to be aware of as an option. Because you may not be an artist in your own definition. You're not painting on a canvas and wearing a beret, but you're still dealing with a life experience that might be really hard, might be very spiritual, might be very overwhelming. And so being able to work through that is, in a creative way, might be a good way. And that's why we're involved as artists.
It's providing them with a place and a time, other things they can learn and gain from it, but yet a place to come together. Sudden cardiac arrest can affect anyone, any age, any time, any place, and it's non-discriminatory. It doesn't matter who you are, it doesn't matter what your health is.
It affects all walks of life, from 12-year-old in our group to 83. And just recently we've got a lot of females. So it really affects all walks of life, doing all kinds of activity, from marathon runners to lazy people on the couch.
In fact, one of the recent statistics I saw showed that many people who have a sudden cardiac arrest, the percentage is over 50%, have no symptoms beforehand. So often with sudden cardiac arrest, different than other types of heart disease, there's no warning signs. It's an electrical failure that happens suddenly.
And that can happen anytime, anywhere, for any reason. It doesn't have to be that you're out working in the yard or working on your car or running at the whatever. It just can happen, and that's the most frightening thing about it. There certainly are risk factors for cardiac arrest, but cardiac arrest is that sudden onset of a lethal rhythm problem in the heart. And that's what kills people.
And we're not talking about people in their 90s. We're talking about people in their 30s, 40s, 50s, and 60s. It's incredible.
For me, I mean, I was 33 years old. Some people understand how it is dealing with an illness, but this is something that is so sudden, and you don't know what's going to happen. It just happens, you know, a lot of times for no real reason.
Look at that. Is that gorgeous? Fit right in your living room.
No way, Dad. No.
Dad? Daddy! Help! Somebody! Help! My dad just collapsed.
I'm from the bank across the street. We have an AED.
Hi, how long has he been down? Have you been
I don't know, a few minutes.
Sudden cardiac arrest touches everybody. Everybody has a family member, a friend, or a neighbor who has had a sudden cardiac arrest or will, in the future suffer from a sudden cardiac arrest. And it's our responsibility to ourselves and our neighbors and our families to prepare for that and to make sure that the best possible outcomes are established and achieved.
And survival rates actually are among the best in the nation. Minnesota's doing very well. However, we're not doing well enough. There's always the opportunity to do better. And, when we look at survival rates, we think that 14%, we're doing really well. 14% is still a very low number. And knowing that sudden cardiac arrest is affecting people of all ages, that number has to go up.
Knowing the signs and symptoms of a sudden cardiac arrest allows you to be seen in a much more timely manner. If you can train yourself and your loved ones to recognize the signs and symptoms, you could have an ambulance there much more quickly than if you did not.
And you can teach somebody how to use an AED and do CPR literally in 20 minutes.
Every 9th grader in St. Cloud and the greater St. Cloud area school system has been trained on how to do CPR with a new little CPR device called CPR Anytime, which teaches people how to do CPR in 20 minutes. And then they can take this little mannequin home and teach their parents and their neighbors how to do it. And they all get credit for this. And so we've trained thousands, some 8,000 people in St. Cloud, Minnesota since starting this program.
We've trained kids down to the age of 5th grade who can successfully do it. It's really simple and easy. It's easy to learn, it's easy to remember, and go out and learn CPR. That's what we need you to do.
I think that it surprises people that it can impact someone of any age. Most of the time we think of sudden cardiac arrest as being an end-of-life event. And often it is. I mean, look at the percentages. It just is. But when we look at sudden cardiac arrest and we see that it's happening to people who are 12 or who are 18 or who are 36, I mean, for most of them, they're not even close to end-of-life events. And often some of the people who are having a sudden cardiac arrest that have been resuscitated, they, even in their 60s and 70s, get 10, 15, 20 more years to be with their children, their grandchildren, impacting society in wonderful ways.
people who experience traumatic situations, I think that it's really hard for the artist to talk about it with others sometimes, but the art gives a way for you to express those emotions and to express those situations and to express the experiences without necessarily doing it in a conversational manner that might not be as comfortable for the viewer or the person that they're talking to.
And I do think that a lot of times people's understanding of the arts in general is that it has to be, you know, the Mona Lisa by the time it's done. But a lot of times you have to make a mess. Sometimes you have to make really aggressive scribbles. Sometimes you just need to put profanity down in color, you know, and just be mad or sad or whatever.
Doing art when you're trying to heal or survive or thrive or do anything really is that idea of switching your perspective and changing how you see the world. Sometimes you get stuck when you're in pain or when something has happened to you, so you need to view things through a different filter and take away your self-criticism or your judgment, and you just need to do. And a lot of times when you're doing art, you lose yourself and you find this whole different part of you that you didn't know you had before the pain happened, before anything.
I had the opportunity to be an artist in residence with Recovery Plus, and we did metaphor sculptures. And so the participants would create poems, real simple poems, creating a metaphor for their addiction and themselves, and then pairing them. And I had one gentleman that created a bird sitting in the puddle, and the wings were back, and when he described this, he said that the addiction is the dust and the dirt that's on the bird's feathers and holding it down and threatening to drown it. And then he said, I'm washing myself clean from my addiction and it's setting me free. So I thought that was really amazing and powerful. He'd never written poetry before. He'd never done art before. And so for him, the sculpture was a very simple, small sculpture, but it was so powerful and so beautiful. I think the experience empowered him in a way that made him take control of the situation and almost made it physical and real.
So I think that this is a really cool opportunity for people to just experiment with materials and work with artists and be okay with the process, and realize that we're not leaving with anything, you know, incredible. But you then again don't know what, you know, you can possibly come up with something pretty amazing if you understand the story behind it.
This is a great opportunity for survivors and their families. I think it provides a wide variety of classes and information that they can really pick and choose what meets their needs. I think sometimes people are apprehensive to come to something like this because they don't quite know what's going to be expected of them. And the benefit of this is that there is no expectations. The idea is to come and to talk and to share, and what you take away from it will hopefully be just what they needed and not make them feel threatened or challenged in any way.
I think the Survive and Thrive conference will be just outstanding for patients and families to just communicate with other people, to see that they have similar feelings and what they feel is okay.
Because I've been through not necessarily illnesses, but, you know, things like family issues, divorce, and you have to go through it, and sometimes you have to turn your brain off and then just emotionally go through it and then come back to it a year later and go, wow, whoa, dude, you know, I was going through this.
It's normal. And so many people want to hear those words that you're not alone and what you're feeling is okay, and it's normal to lose it every once in a while, or to cry for no reason, or be so angry because all this is happening. And those are all normal things that other people going through the same situation feel as well.
I think it introduces you to a whole new bunch of people and this different way of life. Because when I went last year, I did not expect to be so uplifted, because I've struggled so much with my pain, my depression, and then going there was this energy that it sort of built you up and made you think that so many different things were possible. And I think it can involve so many different disciplines and backgrounds, and it just helps you grow in every way.
The Survive and Thrive conference, I think, will be just great for that aspect of, you know, everybody sharing their story and being able to say, I went through that too, I had those feelings too. And, you know, for somebody new coming into it, you may have these feelings. So when you do, you can identify it and you can calm yourself down and call those people at that time and say, I'm having a hard time, this is what's going on, and they know what to do to calm you down, or can say it's okay.
I think the Survive and Thrive conference could be beneficial to anybody who's experienced any type of medical trauma or difficulty in dealing with medical hardships, in that it gives you more tools to deal with situations. It gives you a networking opportunity, and it gives you a way to connect with people that have experienced similar situations. It adds to your toolbox of coping mechanisms.
But my wish again is that people would come and learn about sudden cardiac arrest, learn the difference between a heart attack and sudden cardiac arrest, learn about defibrillators, learn about bystander CPR. All of these things will be given in there in a setting that's really cool, in a sense, really nice.
Well, I mean, I think anytime we hold events or conferences where we can learn from one another, it has an impact on survival rates. There's so many things that are happening in both the academic, in research, and then also even in social work and social or community support and individual support. All of those things really need to come together to make sure we're always doing the best we can. That's the biggest thing. The systems approach to cardiac arrest is something that's eluded us for many years. This idea that if we impact all these different areas around sudden cardiac arrest, we can improve outcomes. And that's what this conference does. It brings together all those different systems into one place to share, to learn, to grow.
So this conference probably will, as you said, last year started, I think we're onto something here, where we can all together in a village help people and have better lives.